Hi, I'm Dr. Michael Marachna, and I'm a board-certified family medicine physician. I work in Valparaiso, Indiana for Porter Physician Services. Today I'm going to discuss smoking cessation. Smoking cessation should really be our number one health priority. For those who do smoke, smoking cessation is the single most important topic related to their health. We know the consequences of smoking: cancer, heart attacks, strokes, the list goes on. Furthermore, I often find patients who take their medications diligently for high blood pressure, diabetes, high cholesterol, but they continue to smoke. I try to put things into perspective for them. They obviously care for their health because they continue to see the doctor, they take medications regularly, but the most important item for their health will be to stop smoking. The actual health benefits from smoking cessation trumps the benefits of treating high blood pressure, high cholesterol, and diabetes. One of the most important things to realize in any behavior change is the concept of stages of change. This is the process that behavior change goes through and is well studied in the psychology literature. Pre-contemplation is a stage where people love smoking. They think it's great, they can never part themselves from it. Some of the things we might say would be to offer what the health benefits are of smoking cessation, talk about the loss of money that they have, which really is about $20,000 over 10 years for a pack-a-day smoking habit. And really, that's a brand new car, or it could be a year of college tuition for their kids. Really, for these folks, what they really want is the nicotine and not all the chemicals that come with it. Basically, smoking is like breathing off the tailpipe of a bus, except there is no nicotine there. Anyway, the key in these patients is to get the wheels moving toward contemplation, where patients are considering smoking cessation, but something is holding them back. It might be their confidence, failed smoking cessations in the past, not knowing how to quit, a partner who still might be smoking, or they might get smoking breaks at work but wouldn't get those breaks if they weren't smoking. The key is to instill confidence, reinforce benefits, and offer guidance to achieve the preparation stage. In this stage, we are laying the groundwork for the action stage. We are setting a quit date, picking a smoking cessation option, and then finally, in action, clearly, we are actively quitting smoking and using the plan that has been put in place. Maintenance is doing the things we need to do to continue not to smoke. At any time, however, relapse to a previous stage may occur. This is not uncommon, but does not give us reason to give up. There are three options for smoking cessation: cold turkey, nicotine replacement therapy, and medications. Cold turkey is an option for some, but not the preferred method, as it has a success rate of about 1 in 20 over a year period. Nicotine replacement therapy and medications can get a quit rate around the high teens to the 20 percentile, with some rare studies indicating potentially a low 30 percentile quit rate. In nicotine replacement therapy, we have a few options. The patch, gum, and lozenges are over the counter. The Nicotrol inhaler is a small plastic tube that contains a nicotine cartridge. It's used just like a cigarette, meaning the user breathes it in, however all of the nicotine is absorbed in the mouth. This is a prescription-only therapy. The good aspect is that it gives the mouthfeel of a cigarette, something to hold in your hand, and there is no flame or fumes involved. It's safe for indoor use. This is not an e-cigarette, but I will address e-cigarettes later. With nicotine replacement therapy, the key is that your brain wants a baseline desire for nicotine, and that's represented by the black line here. So in order to meet that demand, we offer nicotine patches, and we use the number 21 patch for a pack per day smoking habit, the number 14 patch for half pack per day smoking habit, and if people are smoking less than that, we use the number 7 patch. But there are plenty of people who will smoke while they are on the patch, and I know that looks quite ironic, but the reason for this is, unfortunately, the baseline nicotine demand does have surges, also known as cravings, and that's represented by the black curves here. In order to meet the cravings, we need to get more nicotine. Some people will smoke in this instance, which obviously is not what we hope for, but if we are prepared, we can use the nicotine gum, lozenges, or a Nicotrol inhaler at this point in time, and that's represented by these red arrows. As I already mentioned, we have 3 drug options for smoking cessation, and those medications include 2 antidepressants and 1 nicotine partial agonist. This is scientific speak for medication that basically will activate and both block the receptor at the same time. Bupropion is the generic name of an antidepressant that might be better known as Wellbutrin, which is also marketed as the drug name Zyban. However, all of these three medications are the same exact drug. It can be effective, however, we do not use this medication in people who have a seizure history or at high risk for seizures. Nortriptyline is a very old antidepressant, part of the first class of antidepressants to come out. It has good studies behind it and is relatively inexpensive. Side effects for this medication include dry mouth, sedation, and constipation. The sedation can be helpful though, because if people who are trying to quit smoking also need help with sleep, we can use this medication. And lastly, we have Chantix, the most recent anti-smoking drug or smoking cessation drug. As I mentioned above, this is a unique medication in that it both activates and blocks the nicotine receptor. This is why patients who try to smoke on this medication sometimes will feel a disconnect between the cigarette and the usual satisfaction they receive from smoking that cigarette. The nicotine they normally receive gets blocked by the Chantix. This is why some doctors recommend that even people who do not want to stop smoking but kind of want to can try this medication and see if it helps. The two main side effects of Chantix are very well known and very much talked about by patients. These include, for some folks, vivid dreams or nightmares, and for others can include nausea and GI upset. More recently, however, we have been warned to ensure that patients are not suicidal before taking this medication, and the latest news on Chantix has been a potential to increase the risk of cardiovascular events. The cardiovascular event increase came from a poorly done study, so whether this is true or not is still up for debate. So for now, we do not know for sure either way whether it does increase the risk of cardiovascular events. Finally, some helpful tips. It's important to be prepared and knowledgeable. It can take many attempts to quit smoking, and it is key to not give up after one failed attempt. You are worth more than just one attempt to try to quit smoking. If we can, let's set a quit date soon. Some additional assistance can be reached with 1-800-QUIT-NOW, a totally free tobacco quit line that has been paid for by the tobacco companies due to a settlement they reached with the government when they lied to the government about making cigarettes more addictive. In regards to the e-cigarette, although your friends and family may swear by them, they are not approved by the FDA. We don't know if they are safe. They are very expensive as well. So as a physician, they cannot be recommended. Finally, the future won't make smoking cessation any easier, so why wait to get the health benefits of smoking cessation tomorrow? Let's get started. Thank you very much for watching this presentation. For appointments on my office on Route 30 west of downtown Valparaiso at Lake Porter Medical Group, please call 219-464-7430. For appointments in my office next to Porter Stark on Wall Street between Valparaiso and Calumet, please call 219-462-2106. Thank you very much for watching this presentation and good luck in your smoking cessation.